Hi guys, we're back. This is Mike Georgules from CrossFit Sweat Angel. I'm an active release technique therapist, and I'm working with Michelle here today. She's a former collegiate basketball player, and she's been dealing with shin splints for a while now. So what we're going to do is talk a little bit about what causes this and how we can treat this with active release technique. Michelle's pain happens to the anterior part of the leg here, the lower leg here in the shin, right here in this bone, the tibia. So what happens here, she can get some pain here with long distance running or even some short distance stuff. So we can treat the symptom or the cause. So first, what I want to do is treat the symptom here. Could be, she could have some inflammation in the anterior tibialis here, or she could actually have a little bit of inflammation at the bone, the periosteum of the tibia here. So what we can do with active release technique here is we can actually treat this tissue. So I'm going to have you point the foot down with some tension and some active movement. Good. Yeah. Down. So she can actually get a little bit of pain relief from treating this muscle in particular, but what we really have to look at is the mechanics of the ankle a little bit. So typically with shin splints, the ankle is not dorsiflexing and plantar flexing effectively or efficiently. So what we have to do is take a look to the back side of the leg here sometimes and see if the gastrocnemius and the soleus, these calf muscles, are functioning properly. So I'm going to have Michelle flip on over now. And what we're going to do here is we're going to do a couple active release technique passes on her, on the bigger part of the calf here, the gastroc, and then move down to the soleus here. So she's going to shorten the tissue here. I'm going to find an adhesion, create a little bit of tension, and she's going to come in. Very nice. Come back out. I'm going to move up a little bit higher. Fantastic. Come in. Good. So what we're going to do now, we're going to hit the soleus, which kind of runs a little bit underneath the gastroc here, attaches to the same bones of the lower leg. What we need to do now, this interface between the two usually gets a little jumped up here. So we're going to have her point her toes, and we're going to dorsiflex. Good. Same. Good. And we can work all the way down this tissue to the foot. We can even treat the foot a little bit here, hitting some of the plantar fascia, quadratus plantae, digital flexors here. But basically, we want to give you some basic ideas on how to treat this tissue in the back of the leg so that the front of the leg doesn't hurt so much, okay? So what we're going to do now is we're going to go out in the gym and we're going to show Michelle how she can treat this a little bit. Hey guys, we're back with Michelle, and we're going to be dealing with her shin splints, okay? And I'm going to show Michelle a couple ways she can use the trigger point roller to release her tib anterior and some of the muscles in the back of her leg, like her gastroc, soleus, etc. So what she's going to do first here, we're going to actually treat this muscle in the front. So we're going to release it with some trigger point rolling. So she's going to get on top of the roll and place the roll right on the front of her shin. Stay off the real bony stuff, guys. Stay on the tissue itself. All right. So what she's going to do now, she's going to find something that doesn't feel real good, and she's going to put a little pressure in there, okay? She's going to roll back and forth, and she's going to search for something that's a little tighter. Good. And if she finds that, she's going to actually do some toe circles, move the ankle around counterclockwise, clockwise. She's going to spend, 1, 2, maybe up to 3 or 4 minutes on there trying to release that tissue, okay? So once she finishes that, we're going to have her take a seat. And we're going to start treating some of the tissues to the back of the leg, kind of like we did in the therapy room earlier. So we'll start up here at the bigger part of the calf, the gastroc, okay? And what Michelle's going to do, she can either lift her hips, she can put her other foot over top to add a little bit of overpressure here. Good. And she's going to roll side to side, a little cross fiber friction. Okay. She can do a little forward and back, but what I like is a little bit of compression, and then I like to move that ankle around, dorsiflex and plantar flex, because really what she's lacking here is proper dorsiflexion. Okay. All right. What we need to do is maybe 20 to 30 of these. But we're going to take notice here. Sometimes when people roll at their calves, all they really do is kind of go straight on and hit at this vector right here. We really need to think about hitting that that medial portion of the calf, soleus down here, okay? So we got that posterior tib that comes down here. And those peroneals on the lateral portion of the lower leg here, they sometimes don't get any love, and we can actually invert and evert to lengthen those out. So she can do all those motions on her own with some overpressure with her foot, and hopefully she'll be able to release some of those tissues, and when she goes out for a run, she's not going to have that crazy intense pain in the front of the shin like she normally does. So thanks for watching. I'm Mike Georgules. Visit us at CrossFitSweatAngel.com. See you next time. Thanks.